Welcome to Nasdaq Trade Talks. I'm your host, Jill Malandrino, global markets reporter at Nasdaq. Joining us for this segment, we have Jamie Grant, former Chief Information Officer of the state of Florida, as well as Dr. Severence MacLaughlin, UN advisor and founder and CEO of DeLorean AI. We're here to discuss how government, insurers, and enterprises can align around smarter, scalable innovation and how the next decade of healthcare can be more ethical and more investable. It is great to have the both of you with us. Welcome to Trade Talks. Dr. MacLaughlin, great to see you as always. And we know that predictive AI has a lot of opportunity across industries worldwide. Healthcare, though. Healthcare is one industry where we can really use efficiency and more cost savings.
No, and Jill, thank you for having me back on, and I can't agree more with you. I think last time we were here, I was talking about a report by Bessemer and Co., where they were saying that healthcare AI for 2025 is going to be the launch year because it's been an overnight success in the making for decades. And all the technological advances that we've seen over the last 10 years has allowed us to actually implement AI in a way that we can increase health outcomes but also decrease costs. And an example just here right in Manhattan is that Atlantic Dialysis Management Systems, DeLorean AI just came out with a white paper where we decreased hospitalizations using AI by 50% in 60 days. So not only, because when someone goes to the hospital, 1 out of 11 times they don't come home. So it's more hugs for their patients.
Yeah, and Jamie, I think a big part of this is the public-private partnership. I'd include academia in there as well. How can state governments serve as catalysts for healthcare AI adoption through digital infrastructure and through policy modernization?
Yeah, Jill, thanks for having me. It's a great question, and I think there's a couple steps to it. Number one is do no harm. I think one of the things we see in the innovation space a lot of time is policy with the best of intentions actually becomes a great barrier to innovation. And so I think the first step is do no harm. I think the second step is get intelligent and strategic around data governance and the fundamentals that are necessary for government to be that critical partner to support the kind of work that Severance is talking about. And then I think third is just empower partnerships and understand what the different parts of this ecosystem bring to the table. I think the thing I try and stress all day with our company and working across the country is the public sector is uniquely complicated. It has uniquely diverse stakeholders that are all kind of technical in different things, whether it's the technical side of innovation or the technical side of public policy and procurement. Getting that entire group to the table to understand what the objective is and then simultaneously understand how to put each player in that ecosystem in the right position to accomplish that objective. Because I don't think any of us disagree that we need AI to really be a fundamental part of increasing throughput and outcomes in healthcare. I think it requires getting us all to the table to understand how everybody plays their part to accomplish that objective.
But I think, Jill, like one area that here, and Jamie, I'd love to hear your thoughts about this, is that the states have power over administrator of Medicaid and the federal government over Medicare. And I'd like to see, right, the government's really good at the carrot, but not the stick. I don't think the government knows what they don't know. And using AI to be able to say what patients aren't getting the right treatment, what doctors are not being the most efficient, or what vendor, may it be United Healthcare or Anthem, aren't meeting up to the dollars that we're spending, right? We're spending $4.5 trillion. I don't think as an American taxpayer, we're getting really good results for that. Like, are we living longer, or there's a decrease in cardiovascular disease? So I think that so we don't make the same mistake as we did in the pandemic, CMS and the CDC didn't have access to the right data to make the best decisions. And I think we need to move towards that, may that be a policy, but the state and federal governments actually need to use the data that they have to start making better decisions effectively. Jamie?
Severance, I couldn't agree more. I think in a political climate where I think oftentimes the two parties can't agree on the day of the week, I think we can all agree that healthcare is failing the American public and the consumer. If we let the data tell the truth, it starts to expose us where to go. I'd give the bad news first here, and then end with good news. The bad news is the state of the state when it comes to data visibility and data governance in the public sector. It's far worse than I ever knew it was before I took that job. So I had spent a decade in the legislature as kind of the tech policy guy in Florida. We had written the API catalog language, the data catalog language, couldn't figure out why we couldn't get answers in committee. Now I know I didn't know what questions to ask those CIOs from either the agency or the state to kind of ask that. I quickly realized, and I've said this publicly before, like it wasn't long into that job that I felt like Helen Keller playing quarterback because I couldn't see anything, hear anything, or talk to anybody when it came to actually using that data or even knowing how to begin to build or secure. The second thing I'd say to that end, the good news, like that's maybe the bad news. The good news is the intention and the investment has never been bigger. Let's be real clear for the audience and just for everybody. A CIO in America can only go as far as the executive backing that they have.
Agreed.
And until we have governors that get really serious about ensuring that the enterprise is actually operating like an enterprise and it's not a bunch of federated silos that are closer to anarchy than a center of excellence, then you're always going to have this dynamic where maybe you have a state CIO that's empowered on paper, but actually completely powerless. As the CIO of a $120 billion enterprise, I had no direct control over the application, the network, or the infrastructure while wanting to have conversations about how we increase throughput and partner with people like you, Severance. And so I think that's critical that we get there. I do think you're seeing some governors. Arkansas just had an announcement about centralization. Virginia's doing some really cool stuff. And so I do think the governors are going to be critical in this conversation, and it's long overdue that governors actually take a role in this place. The second thing I'd say that I thought was actually a really cool thing, I was able to participate a couple, maybe a month or two ago now, but CMS actually did what I thought was a really great kind of structure to a request for information. Too often the public sector just writes in the background, here's the problems we're trying to solve. Amy Gleason and the team there, and I'm biased, former co-founder in full transparency, but they set up an RFI that like CMS was fully behind bringing in national leaders around to say, what are the data sets you need? What are the problems with what's there now? To really innovate around the procurement space and the purchase space. And Severance, that's one thing that I think folks like you really should be at the table to be part of that art of the possible.
Agreed.
Because so many times we see these things fail just in the procurement design before it even gets to the technology. Most of the problems here are process of government, not so much capabilities of technology.
But I would shoot back on one part there is that, and the federal government, Secretary of HHS, as well as the governors, as Jamie says, we do have the ability to hold accountable the private industries, right? The insurance companies to drive better outcomes, right? And they being innovative. And I agree that the states, all different and 50 different ones, and data governance, Jamie, you know better than I do, but those private corporations, they do have those structures and those tools. So I think we should be asking for more from them.
Yeah, I think.
Sorry, Jill, go ahead. No, Severance is spot on. Go ahead, I didn't mean to interrupt you.
No, I think part of the challenge is too, and Jamie, you made an excellent point about this, is operating in silos. And when you have those public-private partnerships where you don't have a complete picture, this is when it becomes an issue with an erosion of public trust, which is at probably its lowest levels right now. Then you have to think about cybersecurity. You have to think about compliance. If you don't understand how you're supposed to comply and you don't have that bird's eye view, you can have all the money thrown at it as you will, but if you're not leveraging these technologies where there's accountability, auditability, where this money is going, of all industries, this can help to solve the healthcare issues. And there's many of them. I mean, cybersecurity, that's a whole other issue. And
Jill, can I give you a real example? You are like so spot on, more than you even know.
Yeah, absolutely.
Okay, privately held healthcare organization has a publicly disclosed breach back in 2022, 2023. The Agency for Healthcare Administration in Florida reads the news, sees that somebody that is a deliverer of care in the ecosystem has been breached publicly and documented. When the agency asks for information about the breach so that we can begin doing the incident response work, we get the stiff arm that says, sorry, the FBI is involved, we can't tell you any of that information. And so I get a call from the chief of staff at the agency that says, hey, can you come have a conversation with the president of this healthcare organization and their CIO and CISO? I said, absolutely. And so we start asking questions, keep getting the stiff arm. And finally, I politely told them, I said, guys, let's just be clear that we're in partnership here. You get Medicaid reimbursements through a system that we run as a state. So if you can't tell us that the system is clear and that we're not going to risk the infection, so to speak, of other health organizations or patients and patient records, then we're going to have to just go ahead and terminate access to that application. Now, that's kind of the stick example that I don't necessarily love to highlight, but you're exactly right, Jill, that healthcare specifically is like fundamentally a public-private partnership where we have to be securing the patient data. and simultaneously leveraging the patient data. And I think we're at this like inflection point where people are starting to understand that data governance matters, even though it's boring, and data privacy matters, even though it's boring, so that we can do the kind of work that Severance is describing to transform throughput and output to improve outcomes and simultaneously keep the data secure. For far too long, there's been this fraudulent position that we can't innovate without jeopardizing security. The time is now for this industry to come together and understand that security and transformation can work together.
And I think this is a watershed moment, right? Like we have to take advantage now as a U.S. as government-private partnership to actually make this work, right? And I think we have an administration nationally that wants to do that, but we need to drive private. The insurance companies, I think, are the blockers here. We need to move forward. What we're seeing, and Jamie, I'm not sure if you've seen this, is that the provider groups are more adopting AI than the actual insurance companies.
Yeah, well, I think we have to think with a cyber-first mentality, not just through models, not just through product, but through the infrastructure as a whole. As an example, why is there not a sectoral approach as it relates to incident response plans? Yeah. Right? The fact that Jamie had mentioned that he wasn't able to get access to where the vulnerabilities are because there was another agency involved. At the end of the day, what's that doing to help your constituents? So as we're thinking about policy formulation, whether it's privacy law, cyber law, AI law, right? Does it necessarily have to mimic what we're seeing in GDPR? Perhaps not. Perhaps it's too one size fits all, and we need to think sectoral. I think there's a number of ways to do it to still afford that flexibility. But if we don't have consistency with response plans and how agencies are supposed to work together, we're never going to move beyond this point.
Yeah.
Yeah.
Jill, I couldn't agree more. And when Recovering Lawyer hat comes out, when you look at the regulatory approach, it's kind of almost binary. You can think of like making it really hard to get into the market in the name of protecting things. And if that's the case, you don't need a lot of accountability. Or you can think of it as floors and say, look, here's the minimum requirements, and then you're going to pay really significant consequences if you do this. I think if we start to think of government as a platform, and it's something we've tried to evangelize for a while, to think of government as a platform that both has the data sets that we're describing that can be open sourced in a secure fashion, simultaneously in the contracting phase, going back to where Severance was talking, we absolutely could require in the procurement and purchasing process that, like, if you're going to be a provider and a steward of these taxpayer dollars, then you're going to open source some data sets that the rest of the industry can use. I think the caution I would give, I couldn't agree more that GDPR, I think, would be a disaster here personally. I think what we need is a really clear set of standards and floors and really clear accountability for people that violate that. What I saw in my job all day long is stuff that, classified at times, but like things that were fireable offenses, but because they never become public and the governor's office might not care to actually hold them accountable, it just perpetuates. I think we have to establish standards for what this public-private partnership looks like. We need governors that are really serious about high expectations for their team. And then we need a policy framework that invites the innovators and lets the bad actors know if they take advantage of it, they're going to be held accountable in a really painful way.
Yeah, and that's why I agree with you in terms of a sectoral approach. And to your point, regulation by enforcement is certainly not welcome with industries, is certainly based in the U.S. And we know the fines with a GDPR-like framework perhaps hinder innovation because they are so restrictive. So I do agree with you that there needs to be flexibility, but there has to be that consistency. And again, accountability and Severance, these technologies will make the accountability happen. It'll be audible, it'll be transparent, and it'll be available to the public.
But also be searchable, like Jamie said. Like when you're building something like this, as we are at DeLorean AI, we welcome, regulatory bodies to come in. It's explainable. One of the big issues with AI is the non-explainability part of it. And that's really, I think, a differentiator for us in healthcare is why did you make that decision for a next best action for the physician? Well, the heart rate was here and the blood pressure was here, and we were able to show it to the doctor. So that's really, really important for not only for the healthcare, but also liability and things of that nature.
Yeah, and I think it's also understanding your audience.
Yeah.
Right, and I sometimes, in the tech space, if you will, it could be very technical. And Jamie, I'm sure you work with CISOs all the time and other chief information officers, and your role has evolved so quick. And it's such a critical part, whether it's public or private, where you're answering to the board, you're answering to executive management, and you're fighting for those resources that aren't necessarily product or revenue drivers or so forth. But on the private side, it's almost a competitive advantage. As a public side, it's owed to the constituents, right?
Agreed.
Our fiduciary is to the taxpayer whose dollar we're holding when we're in those roles, right? And I think to your point, the technology space has been plagued. We've all talked and been at conferences and heard, soft skills are the emphasis and all these things that are true. I think I would boil it down, and Jill, you said it beautifully. You got to understand who the audience is, what they care about. The board does not care how endpoint detection works. They don't care how incident response happens. They care that it happens and that it's reliable. Your customers don't care how the computer works. They care that the transaction happened efficiently. And so I think we're watching this watershed moments where CIOs and CISOs in America are either going to step up and become true business executives that also know technical, or they're going to make themselves irrelevant in the boardroom because they're just obsessed with how the thing works. And you're spot on, Jill.
Yeah. Well, I mean, Severance, we also have to future-proof this as well. It can't be a set it and forget it exercise where the flexibility and the ability to look forward, because AI, more data begets more data, and this conversation could look very different 3 to 5 years from now.
Absolutely, and we don't know what's coming down. Like we're innovating so fast that I think the other founders that I speak to, like, we're worried about, are we going to be outpaced? Or what's coming around the corner? Is the technology stack that we need to support or the infrastructure going to be available to do the things that we really want to do?
And Jamie, I'm sorry, again.
No, go, fire away.
Is this realistic, right? I mean, there's a lot of performative politics in the headlines that we've been exposed to, right, as the public. Is this realistic? Can CIOs, the healthcare system, policymakers, and the government be flexible, have it available at scale? Can this happen?
Yes. Yes, and it's actually much more simple than we're making it, but to give maybe a bad pun, but something we use a lot, we're focusing on symptoms and not the disease state when it comes to public sector partnerships.
Well,
go ahead, Severance. Sorry.
No, I'm just thinking, I mean, I agree with Jamie that it's simpler than it is, right? CMS gets all the claims. Medicare gets all the claims. Why don't we running the same analysis that the private insurance companies aren't and comparing those outcomes?
Can you share the data, though?
But it's not sharing the data, it's the government, it's the state. It's the state that is paying for it, so they have access to it because they're making those patients better, and then they can actually go back to the insurance company that's administering the Medicare or the Medicare, and then saying, "Hey, you're not doing well here. You're doing well here. We want to see changes there." Yeah. It's the ability to hold those accountable, and I think going back to an earlier part that Jamie said is the vendors that are, these insurance companies. They manage the distribution of healthcare dollars. They're not they're not improving healthcare. And once you kind of figure that out, then you understand why they work the way they do, right? And so I think holding them accountable to drive better health outcomes with AI or even data analytics will drive us forward.
Yeah.
I think to Severance's point, it's really clear, it's really important. Severance, I'm curious if you agree with this. I think a health insurance company is a lot closer to a bank than a physician's office. They are way more in the business of finance and float than they ever are in the delivery of care.
That's a fantastic analogy, Jamie.
Yeah. I mean, and so then when you follow the float, if markets and incentive structures are undefeated, the second thing I want to make sure we come back to, guys, and we could go for.
Yeah, actually, Jamie, I'm going to give you the last point.
Yeah, so here's what I would say if we kind of kept this conversation going. I think one of the things that's really important to understand, Jill, you asked me the question, is this possible in the public sector? What I think the public sector has been plagued by for a long, long time is people not understanding how the sausage is really made, where the incentive structures are, who owns the contract. Because if we draw it down from a 90-10 typical match from CMS down to a state then puts out a massive RFQ that goes to a consulting company that then selects the stack of innovators and kind of beats them down on price. It fundamentally keeps people like Severance and new innovators from the table. So the same time the state in that situation is looking for innovation, they're really mired in this really gross procurement grift that we've seen some national headlines around some of these firms getting some scrutiny on that work. I think if we really want to make sure we get the outcomes that Severance and his team are driving at, one of the things we have to understand is we need procurement and purchasing innovation in America to unlock and unleash the folks like Severance and actually bring them to the table rather than them being like stiff-armed from the table because they didn't hire the right lobbyist or have the right consulting firm or know the right person. We got to get the public sector away from I know a guy to I can solve problems.
All right, and we will leave it on that note and certainly continue this conversation. Appreciate both of your insights. Thanks for joining us on Trade Talks. I'm Jill Malandrino, Global Markets Reporter at Nasdaq.